Hello, and welcome back to the Health Data Ethics Podcast. I'm your host, Jenny Owens, and today I have an exciting guest that I'm so thrilled to be able to speak with. Dr. Hashmi, do you want to introduce yourself a little bit?
Thank you for inviting me to your podcast, Jennifer. It's truly a pleasure to be here. If I had to describe what I do in one sentence, I bridge the gap between potential of AI and its practical application. So my colleagues often describe me as an AI implementation guru or an AI implementation expert because I focus on turning AI into meaningful and measurable results. I think my background reflects my deep passion for applying AI in practical ways. I'm a physician by training with both clinical and research work done at Harvard Medical School. I earned my PhD in healthcare management from MIT, where I focused on AI applications with a master's degree in systems design, also from MIT. And I have served as Harvard faculty, and today I lead Magna Gen AI Consulting as its CEO. So at Magna, I advise leaders on the most critical AI decisions, whether to build, buy, or partner, while establishing governance. So defining KPIs, calculating ROIs, and identifying where AI delivers the highest value is my priority. So in short, I consider myself an internist of AI, diagnosing systemic challenges in AI adoption. And at times, I also act like the surgeon of AI, where helping organizations fix AI projects that aren't delivering or address governance gaps in field applications.
And this is amazing. And I know you and I met at a HIMSS AI leadership event several months ago, and we had this amazing conversation over breakfast, which I could have sat and chatted with you for hours. And I'm so grateful to have the opportunity to talk with you again. But first, I want to talk a little bit with you about some of the work that you're doing today. You mentioned that you do customized AI agent workshops, and you do these for medical fields, specialties like surgery or neurology or cardiology, but you also do executive leadership frameworks for AI readiness. This is a full spectrum of offerings. Talk to me about why that full spectrum. What does that bring to a healthcare organization that might be working with you?
So it's an interesting question. First of all, it was lovely meeting you at the breakfast too, Jennifer. So I had a pleasure talking to you as well. So my customized booster workshops began with a simple insight. Physicians want AI to help, but they just don't know how to apply AI in their clinics, in their research, or even in the OR. From surgeons to department chairs, I saw three big barriers. Fear of job replacement. Believe it or not, even surgeons have it. Misunderstanding of AI's true capabilities, so not trusting AI at all. And then the challenge of finding time to learn because of competing priorities. Now, this led me to create hands-on, specialty-focused AI workshops. Now, as you mentioned, like AI surgery, AI in radiology, AI in dermatology, AI in ICU, I just had that workshop just last month. So my idea is that I design these workshops to translate AI into the language of each discipline and show clinicians or my clients in whatever field they are where AI delivers value. So I always tell my colleagues that AI won't replace your job, but a physician or a client who knows how to use AI will. So, and you'll be surprised, Jennifer. I observed the same gap at the executive level. I saw CIOs, CMIOs, CEOs often struggle with AI strategy. So selecting AI solutions, implementing them within their workflows or without disrupting their workflows, and preparing for failure modes. That's one of the bigger ones. So, and I saw that there was a need there. So I started to address that need by developing these customized AI readiness frameworks, and that those frameworks can assess organizational preparedness, I would say, and ensure clinicians and executives speak the same strategic language. So, in my experience, AI transformation works only when vision meets the execution. And my goal is to bridge this gap.
That is fantastic. Your background in particular with your clinical expertise and your technical expertise makes your perspective so very valuable. I know that you've seen areas where people, desperately want to use technology to help, but don't have the technical expertise, or vice versa. I'm curious because I know that you haven't just done AI workshops in medicine. You've done them in other fields, other highly regulated fields like banking, but other less regulated fields like sports or marketing or the arts or fashion. Are there lessons that you're learning from these other industries that you're able to bring to medicine?
So, I think the biggest difference between healthcare and other industries is their willingness to trust change and adopt new technologies. So, in other fields, AI is moving with full speed. So, marketing teams right now are using AI agents to help clients stay competitive in the LLM market. Artists are creating animated films and music using AI. And we're seeing, like right now, fashion industries, they're designing new collections with AI. And now law firms, they're using AI to prepare and present their cases more efficiently using AI. So almost every industry is actually using AI, and they're using it to its fullest potential. But in healthcare, the gap is not on the patient side, but it's within the organization. So in a presentation I gave at HIMSS Ohio AI Center of Excellence yesterday, I discussed this. I call them the new kids on the block. And it was interesting because I just wanted to say that as ChatGPT Health came out and ChatGPT Healthcare came out and then Claude Health came out. And we're expecting more applications, similar applications from Apple, from Microsoft, from Google. So my understanding from OpenAI Forum is that I learned that their biggest challenge is integrating this ChatGPT healthcare into the healthcare system and not the consumer side, which is the healthcare. ChatGPT Health. And by the way, ChatGPT Health was launched because about 1 in 4 ChatGPT inquiries are about healthcare. So patients, as you can imagine, patients are already AI equipped, or I would say they already have AI tools at their fingertips. And while the healthcare organizations are facing challenges like data privacy, data security, data compliance, avoiding over dependence of AI, both on the provider side and the patient side. So I think compared to other industries, healthcare has this big gap between consumer AI readiness and organizational adoption. So, and I think once this gap is whoever like bridges this gap, whichever big tech giant that is, be it Microsoft, be it ChatGPT, they are the ones that are going to lead the future of healthcare, in my opinion.
I want to take you back for a second to your cross industry work, because as you're working with maybe industries that have had an easier time adopting artificial intelligence, are there implementation strategies or approaches to artificial intelligence that are similar across these sectors?
Yes, absolutely. So I think that's an amazing question. I think there are three winning AI strategy themes that are universal across all industries that I've seen so far. One is that the winners start with workflows, not algorithms. So let's take the example of Morgan Stanley. They didn't start with complex algorithms. Instead, they asked, what's a tough daily task that our employees are facing? And that task was researching for client meetings. So they simply created this algorithm and put it in the tools, what the tools they're using. And so they inserted this algorithm in their workflow. And now these employees are ready and using these algorithms, are preparing smarter client meetings, so almost instantly, and saving so much time. So coming back to it, their strategy was to start with workflows, not algorithms. So find a problem first. And the second was, I noticed that they focus on infrastructure and build cross-functional teams. So let's take the example of Walmart. I love that because we had a whole study on that. So Walmart builds its AI system to keep shelves stocked by doing two things. One is they built a unified data infrastructure, so connecting all stores and suppliers. And the second, they formed mixed teams. So they had data scientists, they had store managers who knows how the customers shop. They had buyers, they had supply chain experts who know delivery logistics. They had all these different background skilled people all in one team. And together with these two moves, which is strong infrastructure and real world expertise, cut empty shelves nearly a third. So I think that was a smart move by Walmart. So that is an interesting example to keep in mind. And then lastly, they establish governance and KPIs before scale. And here I would share a personal experience. So in my advisory experience, I've been brought in after an AI implementation has failed or is struggling. And too often, what I find is this culture of blame rather than ownership. So fingers point on every direction. It's the CEO's fault. It's the IT mistake. No, no, no. It's the vendor's issue. So that's why I strongly believe that when preparing for an AI integration, leaders should look into preparing their hospital systems or clinics or organizations for potential setbacks. So success, I think, isn't just about technology. It's about readiness, responsibility, and resolve to learn and adapt. And I think that's one of the key things to keep in mind as a leader in healthcare, especially.
This is great. I love thinking about workflows before algorithms and thinking about KPIs before you scale. Like these are great. So back when we first met, you had just written a Forbes column and called this a Flexner moment for AI in healthcare. This is a shift from memorization to orchestration, and I didn't know what a Flexner moment was. So I like one of the early things we bonded over was like, please educate me. I want to learn more. So tell me again, for the record, what exactly is a Flexner moment, and what does this mean? What does this change for our clinicians and for our staff at hospitals and for our hospital administrators and educators?
I think that's a fair question. I think right now we are in the Flexler moment for AI. Why do I say that? So in my Forbes column, where I regularly talk about AI, business, and healthcare, I referenced the current AI moment as the Flexner moment in one of my articles. So the last time medicine went through a major change on how doctors think and learn was in 1910 after the Flexner report came out. So the Flexner report reviewed medical schools in the US and Canada and found that many were very low quality and lacked real scientific training. So it led to major reforms and completely reshaped medical education, pushing doctors to move away from memorizing facts and towards scientific reasoning. Now, today, AI is causing that next big shift, in my opinion. Instead of relying on our memory, clinicians will now orchestrate knowledge, meaning we guide, we evaluate, and we work with the AI systems. And these AI systems can gather, analyze, and connect information far faster than any human mind can. So I think a Flexner moment will redesign clinical trainings by integrating AI into every part of the training process. Now, imagine for a second you're a medical resident and you have certain weak areas that you need to work on, and you have these AI simulators that can deliver personalized caseloads for you. Wouldn't that be great? You'll just be able to learn everything. Just imagine you're a resident and you don't have to memorize everything. You are allowed to diagnose a complex condition because you can collaborate. You're allowed to collaborate between your intuition and the trained AI trained on millions of prior cases. So I think training would shift towards orchestrating and not memorizing. That is one of the things I think it's going to happen. And the one thing I just keep emphasizing is that this isn't about replacing expert. And a lot of times, every time I say this, it's like, oh my God, that means we won't be needed. No, you're going to be needed. I mean, physicians, they're not going to replace physicians, hopefully. It's about giving them tools that enhance and strengthen their decision making and training doctors for the future and not the past. Because right now, nothing has changed so far as I know, in training with AI. So I think that big shift needs to happen, and that's going to be the Flexner moment for AI.
Yeah. I think it's really interesting. I like to think about what year was it when the Nobel Prize winner said that radiologists were going to go extinct? Was it like 2012 maybe?
Yeah, around
Yeah.
that time.
I have not noticed that my radiology friends are less busy. I don't know about you.
Well, let's not forget about the new kids on the block.
Absolutely. Maybe the new kids on the block will finally let my radiologist friends like chill a little bit. Maybe. Doubt it. So as we're planning for this future where we have AI ready patients and AI collaborating doctors, how would you assess an organization's readiness for this level of AI transformation? Are there red flags or early signs that an organization might not be prepared?
Yes. So I think it's important to note, Jennifer, that the earliest red flag isn't technical. It's actually linguistic. If an AI organizational leadership talks about only AI vendors instead of AI architecture, they're not ready, in my opinion. If an AI vendor's leadership talks about AI algorithm instead of workflows, they're not ready. So agentic AI ready organizations discuss data infrastructure, workflow redesign, governance frameworks, AI evaluations, KPIs, new leadership roles by involving cross functional teams, as we discussed a little earlier. But the unprepared organizations, you'll see them talking about very basic stuff like pilots, vendors, ROIs, and they're usually confined around very limited use cases. So they're not looking at the organization, they're looking at single use case. So that's when I think they are not ready for implementing agentic AI.
I think that's well said. Thinking about things as episodic or individualistic instead of it's the systems biology thing, right? Like each one of these is playing a role in a larger whole.
Yeah.
So, speaking about our ecosystem that we deal with in healthcare, in you and I are both members of the Northern Ohio HIMSS AI Center of Excellence. You spoke yesterday in the meeting, as well as last month in the meeting, about the EMR divide as a major hurdle for AI implementation. First, can you educate all of us? Talk to me about what the EMR divide in healthcare is and why is it so detrimental to artificial intelligence?
So, and it's an important topic, Jennifer. You won't believe every meeting I go to, we have discussion around it in one way or one form or the other. So the problem is that EMRs were built mainly for billing and legal paperwork, not for supporting smart workflows or doing research. So even when we collect this huge amount of data, it's just not organized in a way that helps clinicians. And a simple example, imagine building an AI tool to help doctors write better patient notes. We know that it's happening already. So, to be useful, this tool might also need access to patients' latest imaging data. If the imaging data is stored in a different format, AI hits a wall. So it cannot see the whole full picture. And that creates a big problem because for AI agents, you need clean data, structured data, and easy to access data to perform and act in real time. But our clinical data is stuck in isolated, hard to connect systems filled with unstructured long notes. But again, I'm going to say that again, but with these new kids on the block, ChatGPT Healthcare is promising to provide such a platform. And as you said, let's have a whole discussion on this, but on this topic. But I'm also writing a Forbes article on this and how there is a potential for ChatGPT Healthcare to remove the EMR divide that we have if it's successful. But that's one of the reasons we are not able to have all these agents in the healthcare system up till now.
I can't wait for this future discussion. It's going to be great to research. Okay, so I mentioned that you and I work together on an AI Center of Excellence. You've talked actually about using an AI Center of Excellence as a structure, like a dedicated department with frameworks, and not just have AI be an IT initiative. Talk to me about how you feel that structure helps scale artificial intelligence.
So, first of all, Jennifer, I think you and John are doing great work. And I think this AI Center of Excellence in Ohio is one of the centers that I think are taking the lead right now. So in my eyes, a center of AI excellence is essential because agentic AI needs skills that not single department can provide. So IT, clinical, or legal, they cannot provide this alone for an agentic AI system to implement in a hospital or a clinical setting. IT knows technology, clinician knows the workflows, and legal knows the rules, but none of them can run AI on their own. And as an AI center of excellence, where all of them can come together, can make this AI work and scale. So without a center of AI excellence, I've seen and standardized AI frameworks, which I think we are working on right now at the HIMSS Center of Excellence Center in Ohio. That we're working on that. So if you don't have these standardized AI frameworks, things can get very messy. And you end up with disconnected pilots, you end up with vendors making decisions for your organization. You have no clear measure for success, you have compliance gaps, and to be honest, a lot of money is wasted. And what I'm seeing right now is a lot of siloed initiatives for Center of Excellence in hospital systems, in hospital departments. Not so within a same hospital like system and under the same roof, we have different departments taking on the lead of AI Center of Excellence when it should be one big Center of Excellence for each hospital system. But this just creates AI islands, I think, and then it just blocks the scaling of AI initiatives to the next level. So I think something to keep in mind for leaders of healthcare is that AI isn't an IT project. It's an organizational shift. You need support, you need a lot of teams, you need change management, you need IT, you need legal, you need clinicians to be part of this, and everybody together can make this shift happen. And hospitals that are going to invest in establishing a center of excellence for their hospitals and learn from the ones that are being offered right now, all these great work that's being done, they are the ones that are going to lead in the future, in my opinion.
I am reminded of a situation that has come up for me at my day job, if I can share. I don't know if we've talked about this before or not, but in my day job, I work in an artificial intelligence center of excellence at Cleveland Clinic. And as I'm going about my business, talking with various specialty areas about what are your use cases for artificial intelligence, what are problems that you want to solve with AI, almost every one of them tells me that they have problems that are unique to their area, so specialized that only their area, really probably has these problems. And the number one problem that everybody thinks is unique to their area is scheduling.
Yes.
And they're not wrong, right? Because the scheduling workflows are unique. They are customized. The correct, encounter type and the correct specialist and the pre-work, it is all very unique and very different. But without that center of excellence, like you've just called out, you can't see that everybody is struggling with the same general problem. How do I get the right patient to the right doctor with the right information all at the same time?
You're absolutely right. You're absolutely right. I think this is one of the bigger problems that I think almost every healthcare system is facing right now.
Yeah. It's funny to me because people are absolutely right. Everybody is struggling with the totally unique problem of scheduling. It's not a contradiction. It's just true. It's just the way it is.
Yes, you're absolutely right.
Dr. Hashmi,
Yes.
we have had a wonderful conversation. We've talked about a lot of things. Before we wrap up, are there any questions you want to answer that I have not asked you, or have we covered everything that you wanted to talk about today?
I mean, I can leave the audience with some advice, final advice.
Yeah.
That is that if you want to build something, build an agile AI infrastructure. Design your center of excellence for scalability, not predictability. Agentic AI will reshape workflows, redefine roles, will keep opening new opportunities. So it's important to prepare for this transformation ahead of time. So here's a simple way to think about it. If your organization is a city, AI agents are the cars. You don't need to know every model of the car that will exist in the future, but you do need good roads. You need traffic systems, you need signs, and you need rules. If your roads are cracked, traffic lights don't sync, and signals are missing, then even the smartest car won't get you anywhere. So, likewise, your data systems are the roads, your workflows are the traffic system, your governance are the signs and rules, and your strong leaders are the drivers who need transparency and clarity. So if the infrastructure is strong, any future AI, no matter how advanced, can plug in and deliver value instantly. Similarly, if the infrastructure is weak, even the most powerful AI will struggle. So my advice would be to build the roads, to keep the focus on building infrastructure, and you'll be ready for whatever AI future brings. To close with a personal note, and I know this is not a class, it's a podcast, but I like to share this, is that so I was awarded with a lot of awards at MIT, which is I'm humbled to share. There was an award that was Graduate Women of Excellence Award. It's a distinction from the Dean's Office. And during the recognition, they asked us to define success in 3 words. My answer then is my answer today, still today, remains my personal and professional mantra. So passion, persistence, and perseverance. So with these 3 Ps, sky is not the limit. It's just the beginning. And with healthcare AI, this is exactly what you need.
Thank you so much for coming on the podcast and talking. I would be delighted to chat with you for hours. Dr. Hashmi, I cannot thank you enough for sharing your expertise, your perspective, and your personal stories. Please come back anytime. We'd love to have you.
Yes, and thank you for having me, Jennifer.